Thinking about tripping? You're not alone. As millions of Americans try psilocybin, new research is tracking that use.
Because as laws change on the state level, what we want to do is understand whether or not this is affecting people's health and whether or not this is affecting people's use patterns. And that is what we found.
Dr. Andrew Monti is the Associate Director of Rocky Mountain Poison and Drug Safety. He's also the senior author of the study that looked at magic mushroom use in the U.S. from 2019 to 2023, just as laws were starting to change. They found psilocybin users jumped from 25 to 31 million Americans.
Well, we knew that use was increasing. And in fact, here in Colorado, right, we know that the state is rolling out this healing center program. They've decriminalized use. And so we expected the numbers to go up, but it was certainly higher than we expected. Certainly, we didn't necessarily expect this to be higher than opioid use or methamphetamine use.
Young people are tripping, and so are older adults. As use climbed higher, so did calls for help.
Yes, absolutely. We've seen an increased number of calls to the Poison Center. But I would also say that we know that use is higher amongst people with moderate and severe depression and moderate and severe chronic pain. And that may suggest actually that people are starting to self-treat with this drug, and that can be risky.
Even with that spike in calls, Dr. Monti says they're not concerned. Last year, Rocky Mountain Poison and Drug Safety took 74 calls about it, from heart racing, medication interactions, and kids being exposed. Still, Dr. Monti says as magic mushroom use keeps rising, more research is needed. Monitoring and talking more about who's using, how much, and how it goes will help them better understand psilocybin use, while sharing information that can help ensure your trip doesn't turn sour.
Plan your trip and talk to your physicians about this. There may be benefits to this treatment, but you have to do this in a way that is going to have a safe environment so that you don't put yourself in a dangerous situation.
Dr. Monti says given that Colorado is becoming a national leader on magic mushrooms and its use, he says this research is critical, especially considering how much psilocybin is now being used. But he says there aren't good systems yet to monitor patient outcomes. He says they're leading the way in developing systems to monitor this, both the good and the bad.
He said plan your trip, which I thought was interesting, but but it also, that's easier said than done, isn't it?
Yeah, but I mean, I think he's just saying that, like, if this is something you're going to be considering, whether that's for a medication or even for fun, you want to make sure you're talking to your doctor and just making sure that you don't have medications that are going to negatively interact with your mushrooms, making sure you don't have a health condition that could cause something to go awry, because we want people to be safe and not get hurt.
Right. It's the young people, I think, that are experimenting that probably aren't planning, if you will.
Sure, but use is up in every age group that they looked at. So this isn't just, 18-year-olds who are just giving things a try. This is older Americans too, and they say that, they might be taking more medications, things that you've got to be concerned about.
Yeah.
Much more to study, and they'll need more time to study a lot of it as well, Rachel.
Yeah.
Thanks.